Harry Dermis has created many poorly made infomercials. Mr. Dermis graduated from Harvard with a master's degree in Canadian Studies and also is a native Hoosier from Indiana, enjoys long walks on the beach, and often wears socks with sandals. Please stay tuned and enjoy.
It's bright out here. How about I use my cloud glasses? Yo, Carl, hit me up with that cane.
Okay.
Ow! Ladies and gentlemen, baldness has plagued humankind since the ancient Roman times. In fact, according to the FDA, over 90% of Americans die from baldness every year.
Wait, well, wrong teleprompter. Okay.
Oh.
Take it down. Oh, I'm sorry, my bad. You just kind of look like an idiot now on national television. Okay, here's the right one. Okay, take two, go.
Wait, it says right here 90% of Americans die from baldness. Oh, that just says Ebola. My bad, guys. Oh, over 25% of Americans get the disease of baldness almost every year, and over 60% if you're really old. Go. Up next. Up next we have Dr. Morey on more info on this peculiar disease called baldness that plagues us so often. Dr. Morey is a skin specialist and graduated from Muncie University with a BS degree in agriculture and a BS Master's in marine biology.
Oh.
We gotta use the bag.
Falling chocolate leaves.
We gotta use the bag. Use the bag. The bag! No! No! The bag! The bag is right there! Get the bag! No! That's a hat! That's an apple! Get the bag! Yes!
Use the bag.
Dr. Morey?
What? Pardon the interruption. As they said, my name is Dr. Morey, and before one can understand baldness, one must first understand hair growth. These are the layers of the skin where hair growth takes place. If you look,
that's
right,
the Earth.
Sorry for the mix-up, but these are the real layers.
That's actually a cake.
You know what? Somebody These are the actual layers of skin where hair growth takes place. If you look
That's
here,
actually the Mona Lisa.
who let him back in here? As I was saying, these are the real layers of
It's actually the Mona
Oh my
Lisa.
god! So hair grows from the follicle underneath the skin, just on top of the hypodermis, labeled here as the subcutaneous tissue.
A hair follicle consists of the hair bulb at the base, where the hair matrix actively divides cells and the dermal tissue supplies blood, are part epidermis and part dermis, and extend to the exterior of the skin, where the hair is visible as dead keratinized cells.
The hair is fed by blood vessels, right here, at the base of the follicle, which nourishes it and allows it to maintain a constant growth up through the other layers of skin. During a strand of hair's life, from starting growth to falling out years later, each hair passes through 4 stages. But now, back to hairy dermis.
Now, hair loss has a number of causes that might make you go bald, and among these include your diet, possible childbirth, stress, and the most common way of losing hair is a common genetic disease called androgenetic alopecia, which causes you to lose hair, and it's from genetic issues. Now, hair loss can result in serious issues ranging from depression to a seriously lowered self-esteem that might result from a similar case such as taking a class with Mr. Butler or even being Kim Kardashian. Now let's review some of the stages of baldness.
Oh, hello. My name is Dr. Professor Armstrong.
Armstrong is a native German who's part of the southeastern Asian tribe of Eskimos. He kind of knows about anatomy and has some knowledge of hair growth, but majored in a study of cats at the University of Harvard.
And I'm here to talk about the different stages of baldness. The first stage is denial, when you lose your hair, but you don't accept it.
This youngster is Baldwin Jr. Unfortunately, he experienced the pain of baldness at a very young age.
The next stage is recognition, when you notice that your hair is really falling out. Final stage, you've lost all your hair and you're having suicidal thoughts.
Hey, you guys want to know something? You're bald!
So son, how has your life been since going bald?
Ha! Bald!
Well, at first, it wasn't that bad. But then my friends started making fun of me for it. And then I saw I was losing more hair. Ever since then, I just became so lonely.
Ha! Bald!
That's it! Don't worry, son. I took care of him. I want you to know, there is a cure for baldness. Back to hairy dermis.
Alright, hold on 1 second.
Good?
She's on fire! She's just
Did you know that your hairs, as soon as they reach your skin, they're actually dead cells? So in fact, it doesn't matter what type of shampoo you use, your hair cells are still going to be dead. So see, you can use this, or that, or this, but your hair cells are still going to be dead. Now let's go back to Dr. Morey to review the stages of hair growth.
Hey, told me all last night was crazy.
Doctor.
Oh, hey, yeah. Thank you, Harry. I'm back to talk about the 3 main stages of hair growth. First, we have anagen. Anagen occurs in the hair follicles, which are part of the dermis. Each hair can spend several years in this phase. The next phase we have is catagen. Catagen is a transitional phase. Over a few weeks, hair growth starts, and then the hair follicle shrinks. Then lastly, we have telogen. That's the resting phase. Over months, growth stops and old hair detaches from the follicle and a new hair begins the growth phase. And by the way, kids, fun fact, most people normally lose 50 to 100 strands of hair every day. That's a lot. Alright, I'm done. About to give me a snick. About to get me a Snickers. Did you eat all the Snickers? Did you eat the last Snicker? No. Answer me!
Well, now to show that baldness isn't all that bad, here's a tribute to some famous bald men who you might know.
Oh, hey. Pardon my, not really professional dress. I was just at the company Halloween party. But back to baldness. There are many cheap over-the-counter medications that supposedly work to reverse baldness. There are surgical procedures, thickening shampoos, and even hair transplants. But the most effective remedy is a medication known as Propecia.
Hello, this is Propecia. Approved in 1992, this anti-bald medication stops hair loss in its tracks and is administered as a once-a-day pill. Propecia has proven to work much better than its predecessor, Rogaine, another hair loss medication. Also, you only have to take this Propecia once a day. Why do you have to take Rogaine twice a day? Make sure you swallow.
Baldwin took Propecia, and in just over 3 months, he regained most of his hair. Now, little Baldwin is more like little Hairwin.
Propecia is an enzyme in... Connor, what is this word?
Doctor, sound it out.
Inhibitor.
Inhibitor.
Inhibitor?
Inhibitor.
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 Inhibitor. Okay. Inhibitor. Inhibitor?
Inhibitor.
Inhibitor. Okay. As I was saying, Propecia is an enzyme inhibitor which blocks DHT, a chemical that can shrink hair follicles until they're... I got another question for you. Till they're almost...
Almost.
Almost. Propecia is an enzyme inhibitor which blocks DHT, a chemical that can shrink hair follicles until they're almost non-existent. It's even caused hair to regrow in certain cases.
Now, many of you should get Propecia, since over 2/3 of us are now experiencing some sort of thinning hair past the age of 35. In fact, most users will see a result in just after 3 months. Actually, before I took Propecia, I used to look like this. But now, I'm hot.